Before you press that flush handle today, you might be washing away the most critical piece of medical data your body produces. Every single day, your digestive system gives you a real-time, highly detailed dashboard of your internal health. It tells you how well you are absorbing nutrients, how your liver and pancreas are functioning, and whether there is hidden inflammation brewing in your gut. And every single day, you probably look right past it, press a button, and flush it away without a second glance. But right now, there is a silent crisis rising in medicine, specifically targeting adults in their 30s and 40s. We are seeing a sharp, undeniable surge in gastrointestinal issues and early onset colon cancers in younger demographics. These are people who are running half marathons, raising toddlers, building their careers, and assuming they are completely invincible. The very first warning sign of this crisis isn't a sharp pain in your abdomen. It isn't a chronic cough, and it doesn't require an invasive blood draw. It is sitting right there in your bathroom. I am Dr. Jonathan Hayes. In my decades of clinical practice, the absolute hardest conversations I have ever had to lead take place in quiet, closed-door consultation rooms with patients who thought they were simply too young to worry about their gut health. They sit across from my desk, totally shell-shocked, saying the exact same heartbreaking words. "Doctor, I noticed something strange about a year ago, but I just thought it was my diet. I thought it was just the stress of my job." En research in Keynes, ears. Before we go any further into the signs you need to look for, I want to ask you a quick question. Let me know down in the comments. Have you ever actually heard of or looked at the Bristol Stool Scale? It is a medical chart we physicians use to classify what normal actually looks like, and honestly, it should probably be taped to the back of every bathroom door in America. I want to tell you why looking at that scale and looking into that bowl matters so much right now. Let me tell you about a patient I recently cared for. Let's call him Marcus. Marcus was 38 years old, a lead software engineer living in Austin, Texas. Like a lot of professionals his age, he spent about 10 hours a day sitting in an ergonomic chair, staring at multiple monitors, drinking a little too much cold brew coffee, and eating whatever was fast and convenient between meetings. One morning, Marcus noticed bright red blood on the surface of the water and on the paper. It wasn't a massive amount, but it was enough to make his stomach drop for a second. But what did Marcus do? He did exactly what millions of smart, busy people do every single day. He rationalized it. He told himself, "I sit at a desk for 10 hours a day. I barely drink water. It's just hemorrhoids." It is a modern lifestyle problem, totally normal. He flushed the evidence away, went to his morning meeting, and forced himself not to think about it again. When it happened a few months later, he discreetly bought an over-the-counter cream at the pharmacy. He treated his own assumption instead of treating his reality. It wasn't until a full 14 months after that very first visual warning sign, 14 months of silent, aggressive tumor growth, that his abdominal cramps and fatigue got so bad he finally came into the clinic. When we performed the colonoscopy, we didn't find hemorrhoids. We found a highly advanced mass that required immediate, aggressive surgical intervention. The tragedy of Marcus's story is not that he got sick. The tragedy is that the data was there, screaming at him every single day, and he just didn't know how to read it. If Marcus had understood the dashboard in front of him, if he hadn't let his age give him a false sense of security, we could have caught that issue when the treatment was nothing more than a simple, highly successful outpatient polyp removal. Today, we are going to change the way you look at your own health. We are going to separate the harmless, diet-driven anomalies from the true medical red flags that demand an immediate phone call to your doctor. You are going to walk away empowered to monitor your own body without falling into hypochondria or unnecessary panic. But before we can spot the danger, you absolutely must know what normal actually is. There is a widespread, incredibly stubborn myth floating around the internet that you must have a bowel movement every single day at the exact same time to be considered healthy. That is simply not true. Biologically, normal is highly individualized. For some people, going 3 times a day is their baseline. For others, going 3 times a week is completely standard for their unique metabolism and anatomical structure. As long as you feel completely empty afterward and there is absolutely no straining or pain involved, frequency alone is not a red flag. The true red flag is a sudden, persistent change from your specific baseline that lasts longer than a few weeks. Visually, when we reference that Bristol Stool Scale, an ideal, healthy bowel movement falls into type 3 or type 4. It should look like a smooth, soft sausage or a snake. It should pass easily, without you having to brace yourself, hold your breath, or sit there scrolling on your phone for 20 minutes waiting for relief. It should also be brown in color. When food passes from your stomach into your small intestine, it mixes with bile from your gallbladder, which actually starts out as a vibrant green fluid. As that bile travels through your digestive tract and helps break down fats, it undergoes a chemical transformation, turning from green to yellow to brown. So, that familiar brown color is actually the ultimate sign of normal, healthy, perfectly timed digestion. But what happens when things don't look like that? What happens when you look down and see bright green, or pale yellow, or shapes that look like incredibly thin pencils? That is exactly where the panic usually sets in for most people. But I need you to understand that not every strange appearance is a tragedy. Sometimes your body is just reacting to what you ate. Sometimes it is just a false alarm. And in the next part of this video, I am going to show you exactly which terrifying looking changes are actually completely harmless, and more importantly, the 3 undeniable critical red flags you must never, ever ignore. Let me tell you about a patient I treated a few years ago. We will call her Elena. Elena was 45 years old, a middle school math teacher from Ohio, and she came into my clinic in an absolute tearful panic. She had barely slept the night before. When I sat down with her, she confessed that her stool had suddenly turned a bright, alarming shade of green. She had spent hours on the internet the night before, convincing herself that her liver was failing, or that she had a severe, life-threatening intestinal infection. She was terrified. I asked her a few routine questions about her medical history and any new medications, and then I asked her to walk me through exactly what she had eaten over the last 48 hours. Elena paused, thought for a moment, and then mentioned that she had just bought a high-powered blender and had started drinking a massive spinach and kale smoothie every single morning to help with her energy levels. I actually smiled and handed her a tissue. Elena was completely fine. What she experienced is one of the most common false alarms in gastroenterology. When you consume a massive amount of dark, leafy greens, the heavy chlorophyll pigment can pass right through your digestive tract and turn everything green. Another reason for green stool is rapid transit time. If you have a mild, harmless stomach bug, or if you drank too much coffee, your digestive tract might push food through your intestines a little too quickly. Remember how I mentioned that bile starts out green and turns brown during digestion? If the transit time is too fast, that green bile simply doesn't have the time to break down chemically, so it exits your body looking exactly the way it started. The same logic applies to sudden shifts in frequency. If you are traveling for work, if you are under immense stress, or if you suddenly increase your fiber intake, your nervous system and your gut microbiome are going to react. You might go 3 times in one day, or you might not go for 3 days. If these changes resolve themselves within a week or 2, and you do not have severe pain, fever, or unexplained weight loss, it is almost certainly a dietary or environmental false alarm. But now, we need to talk about the changes that do not clear up. We need to talk about the 3 specific visual changes that are never, under any circumstances, a false alarm. These are the signs that tell you the structural integrity of your digestive tract is compromised. The first true red flag is something we call melena. Melena is the medical term for stool that appears pitch black. But I do not just mean a very dark brown. I am talking about stool that looks exactly like wet charcoal or roofing tar. It is uniquely sticky, and it often has an incredibly distinct foul odor that is entirely different from a normal bowel movement. When I see a patient with melena, my clinical alarm bells ring immediately. This specific appearance means that there is significant bleeding happening high up in your digestive tract, usually in your stomach or the upper portion of your small intestine. When you bleed high up in your system, perhaps from a bleeding peptic ulcer, severe gastritis, or an upper gastrointestinal malignancy, that blood has to travel all the way down your digestive tract before it exits. Along the way, it mixes with your stomach acid and your digestive enzymes. That prolonged digestive process chemically breaks down the iron in your blood, turning it from red to that thick, terry black. I must add one small caveat here. If you recently started taking an iron supplement or a medication containing bismuth, like Pepto-Bismol, that can also turn your stool black. But if you are not taking those specific items and you see what looks like black tar in the bowl, you do not wait to see if it clears up. You do not wait for your annual physical. You call your doctor immediately. The second major red flag is the one my patient Marcus ignored. bright red blood. In medicine, we call this hematochezia. Visually, this might look like a few drops of fresh blood turning the toilet water pink, or it might look like a streak of bright red painted across the surface of the stool itself. Unlike melena, bright red blood has not been digested. That tells me, as a physician, that the bleeding is happening much lower in your digestive tract, specifically in your colon or your rectum. Now, because so many adults in their 30s and 40s sit at desks all day or strain during heavy weightlifting, they immediately assume that bright red blood is just a hemorrhoid or a small tear called an anal fissure. And sometimes it is, but you cannot make that diagnosis yourself. Bright red blood is also the absolute classic presentation of a bleeding colorectal polyp or an active lower gastrointestinal tumor that is being irritated as waste passes by it. A hemorrhoid and a localized tumor can produce the exact same visual symptom in the bowl. When you see bright red blood, you must surrender the guesswork. Let a physician confirm exactly where that blood is coming from. The third critical red flag is a persistent change in shape, specifically stool, that looks as thin as a pencil or a narrow ribbon. I want to tell you about a patient named David. David was 50 years old, a remarkably fit guy who took his health very seriously. He noticed that for several months, his bowel movements had become incredibly thin and stringy. Because he read a lot of online health blogs, David diagnosed himself with a gluten intolerance. He completely overhauled his diet, cut out all dairy, and started buying $50 bottles of probiotic supplements. He treated his symptom as a wellness project, but the pencil-thin shapes never went away. When he finally sat in my office, I had to explain the mechanical reality of his anatomy. Your colon is an open, muscular tube. It is designed to form waste into that thick, healthy, sausage-like shape we talked about earlier. If your stool is consistently coming out looking like a thin ribbon, it means something is physically obstructing that tube. Imagine putting your thumb over the end of a garden hose to restrict the flow of water. If a tumor or a large advanced polyp is growing on the inner wall of your colon, it narrows the passageway. The stool is forced to squeeze past that obstruction, acting like a mold that compresses it into a thin line. Now, can pencil-thin stools be caused by severe irritable bowel syndrome or intense pelvic floor muscle tension? Yes, absolutely. But if there is a physical, structural blockage developing inside your colon, treating it with a gluten-free diet is like putting a Band-Aid on a broken pipe. David eventually required surgery to remove an obstruction that we could have handled much more easily if he hadn't spent 6 months trying to fix it with dietary restrictions. If you experience any of these 3 red flags, terry black melena, bright red surface blood, or persistent pencil-thin shapes, you need to take immediate clinical action. And when you do, I want you to advocate for yourself effectively. Do not just call the receptionist and say, "My stomach has been bothering me." That will get you an appointment 3 months from now. Instead, I want you to ask your doctor this exact question. I am experiencing a sudden, persistent visual change in my bowel habits that includes, mention your specific sign, like bleeding or narrow shape. Given my symptoms and my age, do I qualify for an immediate diagnostic colonoscopy, or should we start with a targeted stool test? Using that specific phrasing signals to your healthcare provider that you are not dealing with a vague dietary ache. You are reporting a highly specific clinical symptom that requires an urgent, targeted medical response. When you ask your doctor that specific question, you completely change the dynamic of your medical visit. You transition instantly from being a passive, anxious patient to an empowered advocate for your own life. And that brings us to the most powerful tool you have in your arsenal right now: modern prevention. For decades, the golden rule in medicine was that you really didn't need to worry about colorectal screening until you hit your 50th birthday. But the data has completely shifted, and the medical community has had to shift right along with it. Because of the aggressive, undeniable rise in early onset cases, the American Cancer Society officially lowered the baseline screening age to 45. And if you are experiencing any of the red flags we just discussed, or if you have a family history, that clock starts even earlier. You do not wait for a milestone birthday to investigate a bleeding symptom. But here is the most dangerous trap I see young adults fall into. They sit in my office and tell me, "Dr. Hayes, nobody in my family has ever had colon cancer, so I'm not really worried about it. I'm safe." Listen to me very carefully. Relying on a lack of family history to keep you safe is a massive, incredibly risky gamble. The vast majority of the new early onset cases we are seeing in our clinics today have absolutely no genetic precedent. These patients are the very first in their families to face this diagnosis. The environmental and dietary stressors of modern life are changing the rules, which means you cannot rely on your family tree to protect you. You have to rely on vigilance. This is exactly why the screening itself, the colonoscopy, is so miraculously important. I know that nobody looks forward to the prep. I know the laxatives are unpleasant, and the idea of the procedure makes people uncomfortable. But I want to completely reframe how you view this day of your life. A colonoscopy is not just a search mission looking for disaster. It is literal, active cancer prevention. Almost all colorectal cancers begin as small, entirely benign growths called polyps. They sit on the lining of your colon, quietly growing over years, causing absolutely no pain and no symptoms. When I perform a colonoscopy and I see one of those polyps, I don't just take a photo and note it on a chart. I remove it right then and there. By snipping out that benign polyp, we ensure it can never ever mutate into a malignant tumor. You wake up from the anesthesia and leave the hospital with the cancer stopped before it even had the chance to exist. Very few things in modern medicine give us that kind of absolute preventative power. One day of minor discomfort from the prep can quite literally buy you decades of life. But prevention doesn't only happen in a hospital gown. It happens at your kitchen table, every single day. The environment inside your digestive tract, your gut microbiome, is your first and most vital line of defense. When your microbiome is thriving, it maintains a thick, healthy mucosal lining that protects your intestinal walls from severe inflammation and cellular damage. You do not need to spend hundreds of dollars on exotic internet-marketed supplements to protect this delicate ecosystem. You just need to focus on two foundational elements: fermented foods and fibrous plants. Incorporating simple fermented items, like a daily serving of plain kefir, raw sauerkraut, or kimchi, introduces live, beneficial bacteria directly into your system. But those bacteria need to eat to survive. They feed on prebiotic fiber, which is easily found in everyday fibrous plants, like oats, apples, beans, and slightly green bananas. When you feed your gut these real, whole foods, you are essentially arming the microscopic soldiers that protect your cellular health 24/7. It really is that straightforward. Let's bring this all together. I do not want you leaving this video feeling terrified of your own body. Fear paralyzes us. Fear makes us flush the toilet and pretend we didn't see anything, hoping the problem will just magically disappear, exactly like my patient Marcus did. I want you to leave this video feeling incredibly alert and deeply empowered. Your body is constantly communicating with you. When things are functioning perfectly, it shows you. When something is slightly off due to a harmless dietary change, like a new spinach smoothie, it shows you. And when there is a true structural emergency, like the terry black of melena, the bright red of fresh blood, or the persistent narrowing of an obstruction, it screams at you. You are not helpless. You now have the knowledge to look, the exact vocabulary to talk to your doctor, and the simple tools to protect your gut every single day. True health isn't about avoiding every single problem life throws at you. It is about catching those problems when they are small, manageable, and highly treatable. Localized colon cancer, when caught early, has a highly successful cure rate. Timing is everything. Now, I want to hear from you. I want you to drop a comment below using one of these exact phrases so I know what action you are taking after watching this. Comment starting today if you are going to actively check your baseline and start feeding your gut microbiome the fiber it needs. Comment asking my doctor if you have noticed one of the red flags we talked about and you are making that phone call this week. Comment sending this if you know exactly who needs to hear this message right now. And please, follow through on that last one. Share this video with one person today, especially if they are in their 30s or 40s and think they are too young to worry about their gut health. You never know whose life a simple video link might save. Save this video so you can refer back to the red flags, and be sure to subscribe to the channel for more no-nonsense, medical-grade health strategies. I am Dr. Jonathan Hayes. Keep looking out for yourself, and I will see you in the next video.